Let's talk about the influence of signaling molecules on the vasomotion of blood vessels. What I mean by vasomotion is the influence on blood vessels to either vasodilate or vasoconstrict. Vasodilation is going to occur when increased blood flow to a tissue or region is needed. Vasoconstriction is going to occur to maintain blood pressure or to reroute blood to other areas of the body. So let's take a look at this. Active hyperemia is referencing tissue that is metabolically active. And if we look at our favorite metabolic reaction, cellular respiration, down here, glucose plus oxygen is going to give us CO2, ATP, and water. Certainly, this is an incomplete equation, but it's going to suffice for now. If a tissue is metabolically active, it will be producing a bunch of ATP. Coupled to that is an increase of carbon dioxide and also a decrease in CO2. The more ATP we've produced, the more oxygen we've consumed, the more ATP we've produced, the more CO2 we've also produced as the byproduct. As a result, diminished levels of oxygen and increased levels of CO2 will cause vasodilation of arterioles at metabolically active tissues. The vasodilation will increase blood flow to that region, bringing more needed oxygen to continue to allow the metabolically active tissue to continually make ATP. We also have reactive hyperemia. Reactive hyperemia comes into play when there is a blood vessel that is occluded or semi-occluded. Occlusion means there's some sort of blockage in the blood vessel, which is minimizing blood flow to that area. And blood flow is significantly important to allow oxygen to get to tissues, but equally important to get rid of the elevated CO2. Elevated CO2 is going to be around because we're continually making ATP. And as we discussed in earlier videos, elevated CO2, when it combines with water to make carbonic acid, will dissociate into bicarbonate and the hydrogen ion, which we see right here. So elevated levels of CO2 correlate to elevated levels of the hydrogen ion. Elevated levels of CO2 and the hydrogen ion in interstitial fluid will stimulate endothelial cells of blood vessels to synthesize and secrete nitric oxide, which is a potent vasodilator. Nitric oxide is a potent vasodilator. Keep in mind, because nitric oxide is a gas, it cannot be produced and stored because it is lipophilic. It would immediately leave the secretory vesicle. As a result, elevated levels of CO2 and the hydrogen ion not only stimulate the release of nitric oxide, they stimulate the synthesis of it to allow for vasodilation, which will increase blood flow to the area and blood flow away from the area to get rid of that CO2 and the hydrogen ions. The autonomic nervous system and hormones also have an influence on our blood vessels. We talked about the heart having vagal tone, and vagal tone is the diminished heart rate due to parasympathetic activity of the heart, specifically the tonic release of acetylcholine from the vagus nerve to myocardial autorhythmic cells to cause the heart rate to remain diminished during non-activity. We also have what's known as vasomotor tone, which is a tonic release of norepinephrine to most blood vessels in our body. Vasomotor tone is the release of norepinephrine from sympathetic nerve fibers binding to alpha-1 receptors, causing these blood vessels to be slightly vasoconstricted. And the slight vasoconstricted is aimed at maintaining blood pressure. Blood pressure is so important that the goal is to keep many of our blood vessels slightly constricted, decreasing their volume of the container or the volume of the blood vessel to maintain that blood pressure. That's mainly initiated or maintained, I should say, by norepinephrine and to a lesser degree, the hormone epinephrine. But we also have beta 2 receptors that are mainly receptive to the hormone epinephrine. And we find beta 2 receptors on blood vessels of the liver, blood vessels serving skeletal muscle, and the coronary arteries, which are the blood vessels serving the heart. When epinephrine binds to beta 2 receptors on these three areas, the liver, skeletal muscle, and the heart, they cause vasodilation. So keep in mind, for both alpha 1 and beta 2, this is a result of sympathetic activity, otherwise known as the fight or flight response. So during the fight or flight response, we want constant blood supply, oxygen perfusion to skeletal muscle, to the liver to liberate glucose into the bloodstream, and to the heart so the heart can continue pumping with greater rate and greater vigor. And that's only going to happen if we have increased blood supply to that region. So beta 2 receptors to these regions will cause vasodilation. If we look at this picture of the heart, these are representing coronary arteries, and these are what will vasodilate when epinephrine binds to beta 2 receptors. During that same sympathetic response, we'll get even more vasoconstriction due to the alpha 1 receptors in regions of our viscera and other places in our body that are not as vital during the sympathetic response or sympathetic activity. So blood flow is going to be shunted or diverted from those areas to go to the more important areas during sympathetic activity, which once again are skeletal muscle, liver, and the heart. Keep in mind, we have alpha 1 receptors, beta 2 receptors, and don't forget the beta 1 receptors we talked about on myocardial autorhythmic cells and myocardial contractile cells.